Hello, we are the Association for Child and Adolescent Mental Health, or ACAMH for short.
Dyslexia is a specific learning disorder, and it primarily affects the ability to learn to read accurately, fluently, and also it affects spelling abilities. Well, like many people in the field, I got interested in dyslexia because I had dyslexia in the family. I have a brother who was and is severely dyslexic. He was in a lot of trouble at school. He became disengaged. He got into trouble as a young offender. I think one of the things that for me that I remember of those years though was the impact I had on my mother and on her mental health, how she was often crying, and that affected me quite deeply. I didn't deliberately decide to work on dyslexia, though, I should say, because I actually wanted to work on autism, and when I went to see my supervisor, she suggested, well, what about dyslexia? And it just sort of said, oh yeah, that'd be quite interesting. So it did spark my interest, but it wasn't that I sought it out in any conscious way. And of course my own son is dyslexic, so I kind of have seen it from many different angles. And I suppose my feeling is that it is primarily a reading problem, but it has all sorts of ramifications, and they need to be understood. Well, you have to be the mum in the end. And I should say that my son was not someone who was very easy to persuade to have any interventions, and I think partly because I was in the field, he really didn't want to have any special things. In fact, he even refused to have extra time in GCSEs, although his school did force him in the end to have it. One of the things I remember is working as a psychologist, assessing a 6-year-old and saying to the parents, I think this child really is at risk of dyslexia and you should be doing something, and then thinking, hang on, my child's 6 and I'm not doing anything. But we actually taught him on a daily basis at breakfast time. We did some, in the early years we did a lot of reading, everyday reading, but right through to age 11 I used to do spellings with him, and just a few in a structured way. And actually he still says, if you hadn't done that, Mum, I would be completely illiterate. He can now spell, but actually if he's writing, his spelling is terrible. But if you stop him and ask him to spell something, he's pretty good. Identifying dyslexia is something that would normally be done by some kind of reading measure or reading check. In England at the moment we have the phonics screening check, and I think that's the first kind of point in school when you might actually be able to determine whether a child is really at risk of dyslexia, because they'll have had some reading instruction. End of year 1 they get to read 40 words and non-words. If they don't reach the expected level for their age, then an intervention ought to be being put in. If the child doesn't respond to that intervention, then we're getting pretty certain to think that child could well be dyslexic. So that's how it should be being done. Having said that, if it's a severe problem in those early years, the assessment should go beyond just reading words. It should involve reading comprehension, spelling, and also possibly some language measures, something like vocabulary. I think the label dyslexia is an important label because it identifies a group of children with a core impairment in word reading that's normally associated with some problem with phonological processing. I think that if you don't use a label, those children's difficulties are not easily recognised. The problem becomes hidden, and that has all sorts of negative ramifications further down the line in development.
To be part of the advancement of child and adolescent mental health, visit www.acamh.org.